is the DHS 75 overview, and we're going to be talking more in depth about the new administrative code and talk about the specifically about the tobacco treatment and smoke-free policy rules that were included in the code revision. So I'm Karen Connor, and I'm with the University of Wisconsin Center for Tobacco Research and Intervention. And we'll also have two other presenters later on in the presentation. So before we get started, we're going to do a quick poll, and you'll get a few questions that come up here. Go ahead and respond accordingly. There's 3 questions, and these questions just help us get a little bit better idea of who's joining us today, and perhaps if you're seeing snow outside your window or rain. We're getting a lot of rain here in Madison. I know some people have had a lot of snow lately, so depending on where you are in the state, that probably is a good indicator. And then what your role is, just choose whatever best applies in that question. And then if you are a DHS 75 provider, what services does your facility provide? And that can be a check all that apply, I believe. And then while you're completing that poll, we anticipate you may have some questions during the webinar, and that's fine. Please put those questions in the chat and we will answer them at the end of the webinar. There's some questions that any questions that are really specific to the DHS 75 revision have to be asked in a online survey form or online question form. And the link is here, and then I believe that link is going to be put in the chat. But if for any reason Saima, who is from the Division of Care and Treatment Services, can't answer that question just because they're trying to keep those questions, like review all those questions and provide responses to everyone, she'll just acknowledge that and then encourage you to put that question in the form online. But that's the link. I know you can't click on it, but we'll have the link to that question or that website in the question and answer, or in the chat box. And Saima just put it in there, and Luke. Okay, I think the poll is pretty much answered. So we have people from all over the state, which is great, and a lot of different types of people attending. So thank you all for completing that poll. I'll go ahead and share the results so you can all see. And then we'll go ahead and move on. All right, so today's agenda, we're going to start with sort of an overview of the DHS Administrative Code Chapter 75. We'll go over the rule and revision, who the rule applies to, and the levels of care. And then we'll talk more specifically about the tobacco treatment and smoke-free policy requirements within the rule. And then lastly, we'll go over some resources available to assist you with implementing those 2 policies. So the purpose of this project that we're working on with it's a collaboration between UW-CTRI, the Tobacco Prevention and Control Program at the state of Wisconsin, and the Division of Care and Treatment Services. And really, our 3 programs are joining together to provide training and technical assistance for DHS 75 providers to really meet the minimum standards set forth in the DHS 75 revised rules specific to the tobacco treatment and smoke-free policy rules. So you can see here the purpose of that rule is to assist substance use programs throughout Wisconsin to meet these standards and just really provide that training technical assistance that is needed, not only for these programs to meet that minimum standard, but to hopefully achieve best practices at their facilities, however that may look. It's a sort of a flexible rule, but that's just so that these providers can best provide treatment to their clients, and also depending on the type of facility that they're at, establish a smoke-free or tobacco-free policy that makes sense at their facility. So here are the project partners. As I mentioned a little bit before, we have the Division of Care and Treatment Services, and then we have the State of Wisconsin Tobacco Prevention and Control Program, the University of Wisconsin Center for Tobacco Research and Intervention, and then the Wisconsin Nicotine Treatment and Integration Project. And like I said, all of these partners are really working together so that we can really take advantage of this opportunity that was when this revised rule came to play last October. These organizations, just as a reminder, have a year to establish these policies at their facilities. So we're really trying to, get started as quickly as possible, and then be available as soon as possible to provide this TA. And this is really one of the first steps in doing that and educating all of you about what you can do as an alliance coordinator or as a DHS 75 provider to see this happen. All right, I'm going to go ahead and turn it over to Saima with the Division of Care and Treatment Services to talk more about the rule. And I will stop sharing my screen.
Oops. Okay, and I'm going to pull up mine. Just give me 1 second. Let's see here. Oops. I'm going to get it, I promise. So I can't find that button that I had before, so I'm just going to use my notes, but that's okay. So now I'm like most of you guys, schools have been closed. So I have 3 boys, a dog, and a cat in my house. So if you hear hissing, barking, loud screams of joy, I apologize. So, all right, so here we go. I'm really glad everybody's here. Looks like we have a good crew of individuals. I recognize some names and some of my past ASAM trainings. So welcome. My name is Saima Chauhan, and I am the Substance Use Disorder Treatment Coordinator for the state. I also do ASAM trainings throughout the state and throughout the U.S. And we're talking about the revised DHS 75 that will go into effect October 1st, 2022. So what is this administrative code that we're talking about and this revision? So DHS 75, it's to establish like standards for substance use prevention and treatment services under state statute 46 and 51, which those are chapters that provide other details in rules that need to be followed depending on the level of care that you're providing. And so the great thing I believe that is being added to the revised DHS 75 is the rule for tobacco use disorder treatment and smoke-free facilities. Okay. Oops. So why are these changes taking place? So there was an executive order in 2017, and the reason why is Governor Walker's task force on opioid abuse, including on-site naloxone, evidence-based practice for opiate use disorder treatment, and to really simplify and streamline regulations to increase access to care. So it's important to make sure that we update 75 to really align with the evidence-based practices, especially including the on-site naloxone, and also improving opiate use disorder treatment standards and integrate mental health and substance use care, because that, as we know, being in the field, we see a lot of the co-occurring. And of course, updating language, removing stigmatizing or outdated terminology and aligning language with updated state and federal policy, especially being an ASAM trainer and part of the ASAM faculty. You'll notice in the revised 75, a lot of the language is the similar language used in the ASAM criteria. Here. Okay, so who does this rule apply to? Really what I did is sort of cut and paste what it says in the revised. It also says this in the current about who does 75 apply to. So really, I won't read this, but it talks about, you know, public or private operated facilities providing substance use treatment services. And it talks about in accordance with 510119 and 5145-8C. And what that is, once again, is it's a state chapter under the State Alcohol and Drug Abuse Developmentally Disabled and Mental Health Act. I think I got all that right. So that is Chapter 51, which outlines for substance abuse, mental health, developmental disabilities. Here are the standards for those providers. And then next one here, go down. So this just continues, you know, who this applies to under 75. And what this is pretty much saying is you get federal funds from the or state funds for your program. That is also meaning you're under a DHS 75. And then it talks about 7514 and 7515. That's prevention and intervention services for the intoxicated driver services. So also if you're providing that prevention or the OWI service, it also applies to you. Once again, it's a public or privately operated services that request certification by the department. So in other words, if you are asking to be certified under 75. So this is also I won't necessarily need to break all this down, but what this is saying is that, which is new, right? So a lot of the current, as it relates to who this 75 applies to, is similar. But this part right here, it says the provisions of substance use treatment services to patients in the state of Wisconsin via telehealth, right? That's a big thing, which isn't in the current 75, regardless of the location of the program or facility, shall constitute the practice of substance use services in the state of Wisconsin and shall meet the requirements of this chapter. And then this last one is really talking about some of the federal rules. It sort of breaks down, what does it mean if you're a nonprofit? This is what it will look like. What does it look like if you're receiving federal funds? So that's that 42 CFR 2.11. So that it breaks that down. All right, so now that we're all knowing about who this applies to, let's get into the fun part. So what you see here, you also can get this off the web page, and I can put up the web page for the revised DHS 75 implementation. That's the web page you can go to pull this document that you're seeing right now. You'll see a little tab that says crosswalk, and so you can pull this. So what this is showing you, here's the current, right? And then here's the revised, and then in the middle, this is the ASAM level of care. And the reason why I'm showing this is because the new tobacco policy is anybody who is under DHS revised, will have to follow the tobacco policy. So you'll just see a lot of the, obviously the codes, DHS 7514, you'll see they have changed pretty significantly from the current. And you'll see how they match up to the ASAM, because a lot of times when I do my trainings, I refer to, ASAM level of care 3.1. All right, so this is just the other part of the crosswalk that talks about the detox and withdrawal management, because we don't, the word detox is old terminology. So it's being replaced by withdrawal management. So within all these facilities to include withdrawal management programs, the tobacco policy will apply. So what is this tobacco policy? All right, here we go. So here it is. So it's DHS 75-24/7. It's under service operations. And if you attended the webinar on the 11th, we talked about this. So this is tobacco use disorder treatment and smoke-free facility. A service shall have written policies outlining these services, approach to assessment and treatment for concurrent tobacco use disorders, and the facility's policy regarding a smoke-free environment. So, all right, but you'll see here in the rule, so in the rule, let me go back to it. You don't see here like it says, okay, but this, and this, and this should be in your policy. A lot of information as it relates to the current policy, it will state something like, you'll need a policy and procedure that has A, B, and C in it. But you don't see this here and on actually several of some of these rules. And the reason is we want to allow that flexibility. So allowing agencies to determine their own policy and procedures to meet this requirement based on the level of care, where you're located. And so writing policies on assessing and treating tobacco and dependency and writing a policy on smoke-free environment. Now, I used to work at Journey Mental Health, and I had the privilege to be able to work with the team to establish this smoke-free, tobacco-free environment. And there's a lot of toolkits that assist. However, you have these wonderful partners who are willing to connect with you to say, okay, well, here's what a policy might look like. And here are some examples of a smoke-free or tobacco-free environment that they can help you with. So being able to really utilize and getting some technical assistance, I think is important. And that's what they want to do, is really stand beside you and help you create some of these policies and procedures. Right. Okay, so.
Thank you, Sima. I'm going to share my screen now. Okay, so it should be the same slides. But hi, everyone. I'm Sarah Thompson. I'm the Northeast Regional Outreach Specialist with the University of Wisconsin Center for Tobacco Research and Intervention. Always need a breath after that long title. But today we're going to be, for the second part of our discussion, we're going to be focusing on the resources that are available to help DHS 75 providers in implementing the revisions in DHS 75 pertaining to tobacco treatment and smoke-free policies. As a regional outreach specialist, I provide training and technical assistance to healthcare providers, healthcare systems on how to implement these changes already. I have counterparts. I'm located in northeastern Wisconsin and have counterparts throughout the rest of the state, covering all counties that are available to assist you in your correct location. I do want to highlight, as Sima was just discussing, the flexibility of the revisions in DHS 75 24/7 do allow for tailoring to needs and workflow. And as outreach specialists and all of the other resources I'm going to be discussing today, have that in mind, that not every facility is going to be able to utilize the same workflow and policy, and the resources are developed to be able to adapt and tailor appropriately to someone's needs. Before we take a look at the resources, though, I think it's important to start with our evidence base, because that will be consistent across policies and treatment work plans and workflows. So getting started, taking a look at tobacco dependence and tobacco use disorder, and then a little bit of what it currently looks like in the state of Wisconsin and nationally as well. Tobacco dependence is a chronic condition with a biologic basis. Prolonged use of tobacco can result in tobacco dependence and tobacco use disorder as classified in the DSM-5. It is characterized as a physiologic dependence, that physical addiction to nicotine, as well as the behavior habit of using tobacco. So keeping this in mind, the two aspects of dependence and tobacco use disorder, we see that a two-pronged approach is required for maximal treatment effectiveness. Our clinical practice guidelines treating tobacco use and dependence, which summarizes more than 8,000 articles on treating tobacco use and dependence, really emphasizes the need for combination pharmacotherapy and counseling for most effective tobacco cessation. To address the physical addiction and physiologic aspect of dependence, there are 7 FDA-approved medications, 5 nicotine replacement therapy options in patch, lozenge, gum, nasal spray, and inhaler, as well as 2 non-nicotine prescription-only options, varenicline and bupropion. Looking at the behavioral aspect, we want to use counseling or coaching to support behavior change always starting with a screening process, so screening for tobacco use, and then providing appropriate support through cognitive behavioral therapy, motivational interventions, etc. This may sound very familiar to many of you. Essentially, this is a form of medication-assisted treatment where we treat the whole patient, both the physiologic and behavioral aspects of dependence, providing patient-centered whole person care. So what does this look like in Wisconsin? How is tobacco treatment being provided currently? Each year, the Department of Health and Human Services complete a survey of all substance abuse treatment services in the country. And then they provide that data by nationally as well as break it down by state. So we can see some statistics here from Wisconsin substance use treatment facilities in 2020. All facilities were surveyed. There was an 86.8% response rate. So that includes about 295 facilities in the state of Wisconsin. Of those facilities, 71.9% reported screening patients and clients for tobacco use. This is compared to a national average of 75.9%, so slightly lower in Wisconsin. As far as provision of smoking or tobacco cessation counseling, we see 54.9% of facilities in Wisconsin providing some form of counseling, again, slightly lower than the national average at 61.8% nationally. As far as provision of medications, we see that 32.5% of facilities in Wisconsin offered some form of NRT, and 33.9% provided offered non-nicotine cessation medications, are bupropion and varenicline. So that really is our basis for evidence-based treatment on an individual level. However, we know that there are other factors that impact someone's ability to engage in certain health behaviors or receive access to care and evidence-based treatments. Within the clinical practice guideline, it really advocates for a third element alongside the physical and behavioral elements of treatment, and that's to have systemic treatments as well that can address some of those barriers to treatment that certain people and populations may experience. So in addition to medication and counseling, systemic changes can provide that foundation to support all people who use tobacco and are interested in changes. They can really support clinicians and providers to standardize treatment and provide appropriate resources for all individuals. And DHS 75/24/7 really supports those systemic changes on a statewide level, but also allowing the flexibility systems to create those systemic changes internally and support all their patients and clients and even staff in some cases. For example, those tobacco-free policies provide a supportive environment for clients and patients with tobacco use disorder to feel supported in their tobacco cessation journeys. As far as smoke-free policies in Wisconsin in substance use treatment facilities, we refer back to that SAMHSA report from 2020. Important to note first that all substance use treatment facilities do fall under Wisconsin's smoke-free indoor air laws, as do all enclosed spaces. Wisconsin's smoke-free indoor air laws went into effect in July of 2010 and limit smoking in all enclosed spaces and within 16 feet of entrances. Of course, there are a few exemptions to that rule, including private residences, certain tobacco retailers, and certain rooms that are used as private residences in assisted living facilities, etc. The smoke-free indoor air laws do not limit certain tobacco products, such as e-cigarettes and vaping devices, and do not limit smoking on the rest of the grounds outside of that distance from an entrance, unless otherwise specified by local ordinances or a particular facility or building. With that in mind, our SAMHSA report shows that 40.1% of facilities in Wisconsin did not permit smoking anywhere outside or within any building on the campus in 2020. That is the most comprehensive policy in regards to smoking combustible products. Other facilities reported 43.5% reported they permitted smoking in designated outdoor areas. 15% reported they permitted smoking anywhere inside. 0.7% permitted smoking in designated indoor areas, and another 0.7% permitted smoking anywhere inside. So we can see some variance there in level of coverage of the policies. I mentioned we will take a brief look at what other states have done. Have other states been engaging in this work as well? And yes, absolutely. Public Health Law Center shows us that as of March 2020, 5 states required tobacco-free grounds for most substance use treatment facilities in those states. Certainly, those are not the only states to have engaged in this work. There are other states that may have requirements for certain levels of care or certain services and settings, but maybe don't cover all substance use facilities. And other states have certainly implemented rules following that March 2020 date. One state that really has been heavily engaged in this work is New York, which really was the first state to require all state-funded or state-certified addiction treatment programs to be 100% tobacco-free. This change took place in 2008. And we do have some research and evaluation following that change to show what the impact was on facilities, patients, and providers alike. So one qualitative examination of the policy found that 1 year post-passage, 46.6% of counselors reported positive behavior change. And that positive behavior change included less smoking, improved health, and greater intentions to quit smoking. Counselors also reported, about 15% also reported improved overall treatment. A second study looking at the policy changes found that patients who completed treatment were more likely to have quit smoking at discharge versus patients who did not complete treatment. So about 39.4% who completed treatment had quit smoking versus 18.1% of people who did not complete treatment. The same study also found that tobacco-free policies had no noticeable effects on admission or treatment completion. Interestingly enough, New York has had some change in their policies since that time, but when we look at that SAMHSA report in terms of how they're doing with providing tobacco treatment in substance use facilities, we see that 96.8% of facilities screen for tobacco use, 91.8% provide cessation counseling, and almost 70% offer forms of NRT to patients and clients. So very strong provision of tobacco dependence treatment and tobacco use disorder treatment in New York. So DHS 75 24/7 really provides an opportunity to equity in a population that we know experiences very significant disparities around tobacco use. Research shows that individuals with substance use disorders use tobacco at higher rates than the general population, about 2 to 4 times higher. That can vary by certain subgroups. And they experience significant disparities in related morbidity and mortality. Research average that individuals with mental health or substance use disorder challenges die on average 5 to 25 years prematurely than the general population, and more than half of these deaths are caused by tobacco-related diseases. Research also shows that individuals who use tobacco are more likely to die as a result of their tobacco use than another behavioral health condition or the primary behavioral health condition. So getting into those resources now, how do we make changes? There are a lot of resources available, but there are 3 primary resources that I want you to remember as our takeaway from our conversation today. The first being helpusquit.org. This website is already available to visit at any time with a variety of materials, videos, fact sheets, free trainings that are already available for your utilization. The website is getting a little bit of a revamp and reorganization that will be launched soon, and we're really excited about, but it is currently available for anyone to access right now. I'll touch on some of these examples in the next few slides. The second big resource is technical assistance. As I mentioned at the beginning, I am a regional outreach specialist, and I provide training and technical assistance to healthcare providers and focus on tailoring that technical assistance to the particular facility or clinic that I might be working with. I have, as I mentioned, have colleagues in other parts of the state as well who can cover all counties, and we are available right now for free training and technical assistance. If you are interested, again, I'll talk a little bit more about that on further slides. And the third big resource are the toolkits. We are creating 2 new toolkits that will be launched very soon. One focusing on evidence-based tobacco treatment, and the second focusing on tobacco-free environments and creating a strong tobacco-free policy and how to implement that policy within a behavioral health setting. Both toolkits really are focused on DHS 75 and a behavioral health population, individuals who might be living with other substance use disorders and in substance use treatment facilities. But these resources will be meant to be tailored to the various levels of care and various settings. So to take a closer look at some of those resources available at Help Us Quit, just some samples of posters and fact sheets that are currently available there. On the left-hand side, we see a poster that is available for this population. In the middle, we see a sample chart looking at tobacco dependence treatment medications. So comparing all 7 medications to dose, looking at specific side effects, and maybe a compare and contrast for certain individuals who might be selecting the appropriate medication for them. On the right-hand side is just an example of a fact sheet with certain data and statistics around the topic that may be of interest to some of you. I mentioned that there are also some videos available on helpusquit.org as well. Here is an example video. Unfortunately, I'm not going to play today just due to tech challenges over Zoom, but I believe someone will be putting a link to this video in the chat if you want to view later. This particular video is about 3.5 minutes, but there are a variety of videos like this, short videos, 2 to 4 minutes, as well as longer hour-long trainings if you are interested. They all focus on this specific behavioral health population, but there are videos from varying perspectives, from administration, leadership staff at certain facilities, therapists, counselors, as well as patients and clients themselves, looking at how and why to treat tobacco use, for example. The second big resource I mentioned is training and technical assistance. Here are just some examples of training and technical assistance that are available, oftentimes focusing on the evidence-based treatments in training, the counseling, medication, the 5 A's, how to integrate those evidence-based treatments into a clinical setting. We are available for in-person or virtual training depending on your needs. For technical assistance, this is meant to integrate tailored tobacco dependence treatment or tobacco-free policies into varying healthcare facilities. Some examples of that technical assistance are to help establish a tobacco treatment protocol and identify appropriate roles for the clinical team. We are available to help with development of workflow and policies in this area, as well as how to integrate the Wisconsin Tobacco Quit Line. We don't have time to talk about the Quit Line today, but I would encourage you to take a look if you are not familiar. It is a free telephone-based counseling service that can serve as a treatment extender for patients and clients, in addition to what they might be receiving in a clinical setting. If you are interested in learning more about the Quit Line, I encourage you to reach out to your outreach specialist and perhaps and just have a conversation about the quit line, or perhaps set up a brief training for your staff to learn more about the services and programs that are available. Again, this is not an exhaustive list of all the topics available for training and technical assistance, just some examples for you. I mentioned the outreach specialists. So here is a map of where we are all located. I am in Green Bay, Wisconsin, and cover northeastern corner of the state. Ali Gorilla is located in Milwaukee and covers Milwaukee and surrounding counties. We have Amy based out of Madison, who covers southern Wisconsin, and Susan Lunston based in northwestern Wisconsin, based in La Crosse and covers northwestern Wisconsin. So all counties are covered. Please feel free to reach out to myself or your appropriate outreach specialist, and we are available to help you now. Additionally, we do have other staff within WinTip and at UW-CTRI who are available to further support us through the training and technical assistance as well. A lot of expertise between those two groups. And our final resource, as I mentioned, is the toolkits that will be launched very soon. We hope this will be a very beneficial resource for you to be able to tailor and adapt to the resources that already exist, provide somewhat of a step-by-step guide how to implement and integrate tobacco treatment and smoke-free or tobacco-free policies into a facility. We do have an upcoming webinar on April 5th that will provide an overview of these toolkits, provide some highlights of the tools that are available within them, as well as somewhat of a guide of how to utilize the toolkit to tailor it to individual needs. So that webinar is on Tuesday, April 5th at 10 a.m. Registration is already open. I believe someone is going to be putting that registration link in the chat if they have not already done so. So we hope to see you on April 5th, and please save the date and share with your networks.